Dr. Leonora DNP, a nurse educator, correctional health leader, and your go-to for real talk and real skills in healthcare. And welcome to my very first episode of Vitals and Vibes, where we protect licenses, we elevate your practice, and we keep the energy high all year long. And today's episode is all about the basics. As we go into 2026, we're going to start here with the basics that saves lives and protect your practice, whether you a CNA, whatever, a nurse, LPN, RN, and that starts with vital signs. So here is a quick check-in question. Have you ever caught something major just by checking the patient's vitals? Drop 100 in the comments or drop a heart in the comments if vitals helped you catch something in the patient before they crashed. Because listen, vital signs is not just busy work, something to check off, some tasks we got to do. They're the frontline cues to tell us when to act on a patient, when to escalate things up to a provider or up to the nurse if you're an LPN or you're a CNA, when to elevate things and when to protect our patients and protect ourselves. So today we're going to break it down. So we're going to talk about the 4 major vital signs and then we'll get into a few others. So first, number 1 vital signs is temperature. And normally temperature in a normal adult is 98.6 degrees Fahrenheit. But remember, every person has his normal baseline. So it could be a little bit lower than that or a little bit higher. But if it spikes between 100 or spikes above 100.4 degrees Fahrenheit, then that could really mean sign of infection, some inflammation, or it could be that the patient is now septic. So always recheck elevated temperatures and make sure that when you're documenting the method that you took the temperature, whether it was oral, tympanic, or ancillary under the arms, because that really matters. So make sure you put that in your documentation. Vital sign number 2, the pulse, or what we call the heart rate. And in a normal adult is usually between 60 and 100. That's usually normal. But if it's lower than 60, then we call that bradycardia. Or if it's higher, then it's tachycardia. And below 60 could be normal in athletes, or it could be deadly in sepsis. So what matters more is really the trend. So has it been trending up, or has it been trending down? So if it was 88 at noon and now it's 114 and beats per minute and they haven't had no activity, they've been sitting still, then that's a clinical red flag. So whenever you check in the pulse or the heart rate, you want to also make sure that you're checking the rhythm and the strength too. So is it thready? Is it bounding? Is it irregular? All of those things you need to make sure that you documenting that in the record. Our third vital sign, the respiratory rate. And this is the most under-assessed, most under-documented, and possibly the most sensitive sign of a patient decline. And normally it's between 12 and 22. If it's going above 22, now we're trying to get into the danger zone. So don't be guessing. You actually need to watch and you need to count it. And, pro tip I give you is when you taking the pulse, you can also keep doing it. And so the patient don't get anxious and you really looking at the respirations at the same time. So make sure that y'all document that respiration rate. That's always missing most of the time in documentation. And then the 4th vital sign is the blood pressure. Oh my God, the blood pressure is so important. So ideally, a normal person's blood pressure is going to run you between 120 over 80. And if it's too low, then that means they hyperperfusion. And if it's too high, they could be at a stroke for risk, especially in our men. So men, y'all need to put all that sodium down. Tell us if you got a headache so we can understand, is this a blood pressure issue or is this something else? So my nurses, my CNAs, always make sure that you recheck any abnormal readings manually with the manual cuff, the stethoscope. Get the manual cuff, right? Don't just try to, I know y'all love that Dynamap, but put that Dynamap down because machines can lie sometimes. So make sure if you get an abnormal reading that you actually doing a manual blood pressure, and make sure you documenting the position of the patient, whether they standing up, sitting down, lying down. if they was calm, if they were stressed, and also if they're dizzy or hypertensive, so meaning the blood pressure is too low or is newly altered, then sit them down, call for help, and make sure that you document everything. All right, those are the 4 major ones, but now we're going to talk about 2 more that we need to pay attention to. 1, can you guess it? O2 saturation, right? Or the pulse ox is what we call it. So that needs to be between 95 to 100% unless you a patient with COPD or if your patient has COPD. And then the 5th vital sign, what we call pain.
Kill me! I'm in constant pain!
Yeah, always we call it the 5th vital sign. So, but it's the only one that we cannot see. So please, can you believe the patient when they tell you they in pain? And I don't want to see any of that negative documentation in the chart talking about, oh, you know, if they tell you they're in pain, we can't see it, we can't feel it. So you got to go with their word. So believe the patient and document your reassessment. So let me say this clearly again, that is the basics of what we do as healthcare clinicians. We need to take the vital signs. They are not just something that you check off a list of tasks that you got to do and we ain't paying no attention. That is a clinical tool that we need to use to make sure that our patients are okay and to protect us legally. So charting a normal blood pressure and ignoring a high pulse rate is not good. You need to make sure that you are charting everything that you see. But if you got a high pulse rate or you got abnormal vital signs, you need to report it and you need to escalate care. So make sure that we're doing that. That's how people can lose their licenses. So here's my advice. Treat vital signs like vital decisions that you make. Trust your gut. And when something is off, make sure that you are speaking up and you are documenting the full picture. So that's your Vitals and Vibes check-in for the week. So if you learned something today or you just needed a reminder about those real basic skills, the vital signs are so important. Make sure you like, comment, and subscribe right now to Vitals and Vibes. Drop a heart if you're a CNA, a LPN, a RN, a nurse practitioner, a tech, a MA, that you are keeping your patients safe with your eyes, you trusting your instinct, and using your hands and making sure that you documenting and tag somebody that needs to hear this message. So until then, keep your vitals sharp and your vibes high. This is Vitals and Vibes with Dr. Leonora DNP, and I'll see you next week.
But these bitches in my business call me ultra choosing violence. If you see me out in public, you